2 o'clock. Calling this meeting, the Community Services and Public Safety Committee meeting to order, the March 2nd, 2026. If we could all please stand for the Pledge of Allegiance. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Sarah, this agenda has been posted and published in compliance with FOIA?
Yes, sir, it has.
All right, if I can get a motion to approve the agenda?
I'll make that motion.
I'll second.
All right, can the agenda be approved without objection?
Yeah.
Seeing no objection, it is approved. Moving forward, can I get a motion to approve the minutes from February 3rd, 2026?
So move.
And a second?
I'll second.
All right, thank you. Is there any objection to accepting the minutes from February 3rd?
No.
Seeing no objection, they are approved. Is there anybody signed up for public comment? All right. Is there anybody in the audience that wishes to speak at this time? All right, seeing nobody, I will close the public comment and move into the Assistant County Administrator report. Good afternoon, Audra.
For my ACA report today, I have asked Rebecca with Nexus Care, the director, to provide a 2025 service report, which includes an overview of the total number of patients served and the prevention and outreach events conducted throughout the year. And she would also like to share the recent initiative with SCORF money. Rebecca?
How are you doing? Thank you for being here.
Good afternoon, Chair and committee members. It's a privilege to be here. It's always exciting for me to come before you and get to share the service that we provide to the citizens of Beaufort County at Nexus Care of Beaufort County. And I want to just sort of think for a moment about the vision that we have and how the information I'm going to share with you ties to achieving the vision we have, which is a healthy and thriving community that's free from the negative effects of substances. And so for this vision, we offer a continuum of services that ranges from prevention, which is so important, to make sure that people never start using substances. And there's a lot of factors that go into that. We also offer intervention services for those who are starting to use, but not to the level of having a diagnosed substance use disorder. We offer outpatient and intensive outpatient treatment, and we also have peer recovery services. Between July 1st, 2025 through January 31st, 2026, our prevention team, which consists of 5 full-time employees, has addressed primary substance use prevention, giving 28 speaking engagements, reaching almost 1,500 citizens so far. We've completed 23 health fair events reaching nearly 1,200 citizens and distributed already over 2,000 pieces of prevention literature. We have 35 social media campaigns. We've reached almost 137,000 people so far. We have public service announcements on impaired driving, reaching 127,000 people to date. We've also completed 2 full cycles of a program called Thrive. This is for middle school students, and they receive instruction through a curriculum for their age to prevent substance use by creating resiliency, things like communication skills and healthy habits. We've completed 2 cycles and hope to complete at least 2 more this year. We also have the Palmetto Retailers Education Program, which is education on service of alcohol for off-premise sales. So this would be to your outlets that sell but do not serve alcohol on premises. And we have completed so far 9 classes and reached 16 merchants, with several more scheduled. We're also proud that we've been able to launch our tobacco education program for youth, which is middle school and high school students, virtually. Therefore, it does not interfere with their instructional time during school hours. It can be done virtually in the evenings. It is 2 sessions at a total of 6 hours of curriculum that not only helps prevent tobacco and marijuana use, but addresses those who are beginning to use it but haven't yet had a diagnosed problem. Our opioid outreach coordinator has already completed 18 community events, distributed 262 drug disposal kits for safe at-home disposal of substances, and distributed 250 boxes or 500 doses of life-saving naloxone for overdose reversal. Our intervention services between January and December of 2025, the full year, has completed services with 279 individuals. This program is the Alcohol Driver Safety Action Program. We are the only ones in Beaufort County that provide it. This is for people who have a DUI offense and have had consequences with the Department of Motor Vehicles for their driver's license being suspended until such time they complete an intervention program. And we've served 279 people, and we have that in both English and in Spanish. As for treatment, in 2025, we admitted almost 700. 696 people were admitted into our treatment services. Of those, 144 were adolescents for outpatient treatment. 195 were admitted to adult outpatient, and 83 to adult intensive outpatient, which is our highest level of treatment. We've also served 29 individuals with medication-assisted treatment. And at our detention center, between July 2025 and February 2026, 24 of the residents have completed a clinical intake while incarcerated. 9 have completed the group program. And on March 16th, we will have a new position there, a peer support specialist, a person in long-term recovery, that will help those residents with transition planning and reentry and warm handoffs to community resources and outpatient treatment when released. Currently, the department employs 28 full-time staff, and we have no vacancies. They are all filled. I like to say that, and I hope we continue to be able to do that. In recovery in 2025, we served 111 individuals with peer support services. Those are provided in a one-on-one or a group setting to our patients who are navigating through the recovery lifestyle and learning to build recovery capital so that they can achieve and sustain long-term recovery. And they are guided by certified peer prevention specialists who have overcome issues with substance use disorders themselves and are in long-term recovery. And they are a great source of support and part of our clinical team. Our patient satisfaction surveys, of those patients who completed the survey, 100% reported they are satisfied with our services and likely to recommend to others. That is something we are extremely proud of. Among the patients completing discharge surveys between 70 and 120 days after completing care, the vast majority reported that they were either in remission from substance use disorder or saw a significant decrease in their substance use. Patients complete a survey and also again at discharge. Upon admission, only 25% of patients expressed that they had the ability to handle a crisis in their life. Only 25%. Post-discharge, that number was 94% were able to manage a crisis in their life. At admission, only 28% felt good about the quality of their life as a whole. Post-discharge, that number increased to 95%, saw improvement in the quality of their life. So those are good outcomes for us, very good outcomes for us. In 2025, we had 21 fatalities that have been confirmed by the coroner's office due to overdoses related to substance use, 2 of which were classified as death by suicide, 2 of the 21. Between 2021 and 2025, we have seen a 57% reduction in fatalities related to substance use in Beaufort County, per the coroner's data. In 2025, the fatalities ranged in age from 18 years old to 69 years old. That is a very wide age demographic. We know that the drug supply is very lethal in Beaufort County. The complexity of synthetic substances in the drug supply involved mean that overdoses are even harder to prevent because reversal agents like naloxone will not work on synthetic drugs that are not opioids. Fentanyl is something that we hear a lot about. Fentanyl is still the primary accelerator of mortality in Beaufort County. It was present in 65% of the toxicology cases. Combined substances were in 40% of those cases, showing that stimulants like cocaine are an additional risk factor. And we also know that substances can be laced with chemicals like fentanyl. And there are also counterfeit pills, fentanyl hidden as other pharmaceuticals that are actually fentanyl and not what the person thinks they are taking. It only takes one of those counterfeit pills to kill you on the first time you use it. How are we addressing this? In addition to the vending machine that I previously reported, we were able to place in the detention center with access to free naloxone. I'm proud to say that we just placed 7 naloxone kiosks in Beaufort County. This is something the citizens have wanted and needed to prevent overdose and reverse overdose fatalities. Those kiosks are placed one at each county library outside where there's 24/7, 365 access to free naloxone and information on how to get help if help is wanted. We also placed one at the Myrtle Park building in Bluffton, and we are ordering another one for outside the Human Services building at Duke Street. Last week, we deployed 350 boxes or 700 doses of life-saving free naloxone in our community. This is possible due to the South Carolina opioid recovery funds from the lawsuit settlement with the manufacturers, distributors, and pharmacies that perpetuated the opioid crisis in the United States. So the path forward. Our path forward has really 4 pillars. We want to focus on advanced harm reduction with overdose response strategies that do include the use of synthetic drugs in addition to the opioids. The second pillar is the integration of mental health screenings in primary care to prevent suicide or pharmaceutically induced death by suicide, as well as mental screenings that can also lead to substance use. The third pillar is chronic disease management. Of our fatalities, many accidental drug toxicities occurred in people that were suffering from underlying medical conditions, per the coroner's data. And 4, we need broad demographic outreach spanning youth to seniors across diverse backgrounds, because substance use and fatalities are across the whole spectrum, not just any particular group. And to conclude, our next step is to complete a comprehensive needs assessment that will identify the strengths and gaps in Beaufort County, and to use that information to develop a 3-year strategic plan for opioid abatement. We are in the final stage of reviewing proposals to partner with public health research to conduct this study with our key stakeholders in 2026. I look forward to updating you when we have those findings and recommendations and a proposed strategic plan. And with that, I'm pleased to assist you with any questions that you have.
Thank you for that information. Is there anybody that has a question right now? No?
I do.
No, yes.
Thank you for your report, giving us an update on the opioid situation we're dealing with. You talked about the reduction in fatalities, and was that contributed to naloxone?
That's a very good question, and yes, there are multiple factors that contribute. Some would be prevention campaigns, letting people know the dangers associated with opioid use, and then, of course, having naloxone available for people to reverse an accidental overdose or a drug poisoning nationwide has led to a downward trend in the number of overdose fatalities. So we know that naloxone does work. It does save lives.
You also mentioned the counterfeit pills. So they're out in the market. They're selling these pills as pharmaceutical pills.
That's correct. They're typically sold to look like something like another medication, typically like either an antidepressant or an anti-anxiety type medication. And like a benzodiazepine, which is a anti-anxiety medication. So with that, a person who takes a pill from someone, then it wasn't prescribed to them. They don't know for sure what they're getting, or if they buy it on the market and it's not prescribed to them, they can't be assured that that pill isn't actually a counterfeit pill that is fentanyl instead of the medication.
Thank you.
Yes, sir.
Is there anybody else? Yes.
I recently read about, excuse me, heated tobacco products. There was a bill about how they're going to tax it, and I didn't know what those were. I guess it's is that vaping or?
I believe they're looking at putting a tax on vape products at the South Carolina legislature.
Do you see with the teenagers a lot of the vaping?
Our number one admission reason is cannabis use amongst adolescents, and second is tobacco or vape. So those are the top two issues that our youth are struggling with in Beaufort County.
Mr. Weber.
Yes, I was going to ask the same question about vaping, because it is a problem among teenagers. So the other concern I have, not a concern, but you talked basically a lot of statistics you presented tonight, so my brain can't take all that in. But I'm hoping that you would provide that to us at some point. But when you started talking about the Thrive program, or the Thrift program, which one is it?
Thrive.
Okay. I was wondering about, I wrote down measurements. You know, how are you going to measure these programs you implement and stuff, see what the kind of results? You gave some measurements at the end, but it's like 1 year, and I guess I'm more concerned about relapse and people coming back, and how do you measure that, and are you measuring that? Because you're providing success, and so they 85% say they like the program, et cetera, et cetera. Are you getting any reoccurrence from those same people? I do have relapse. I'm an addict myself, and so I do have relapses. Not that I know it's wrong, but somehow I find myself picking up what I shouldn't be picking up, that sort of stuff. So, yeah.
So thank you for your questions. I heard two things there. With the Thrive program, it's for middle school age students, and we have found through our data that that's really the sweet spot for education, where by the time they get to the 9th or 10th grade, they already don't perceive harm with using substances. So we want to get ahead of it at that sweet spot middle school age. I have a middle schooler myself, the last of 5 kids, and middle school is really where prevention messages are best received to stop or change their perception that there is harm before they get into high school and they're surrounded with it. So with the Thrive program, the prevention team is trained to administer this program, and the next step will be for us to be able to train others, perhaps in the school district or in the private schools, to be able to also administer and replicate that program, so that this curriculum they implement, the students take a pretest, and then after they've completed the program and graduated, they have a post-test. And it shows the measure of their increase in knowledge about how to live a healthier lifestyle, make good decisions, resist peer pressure, and those type of topics. So that's really with the Thrive prevention with middle schoolers. As for outcomes for treatment and, as you say, relapse or a return of symptoms or a return to using substances, we know that substance use addiction is a chronic health condition. And so being that it is a chronic health condition, that is how we approach it. And the American Society of Addiction Medicine advises us to look at it that way, approach it that way, and normalize the fact that when people have a recurrence of symptoms of their addiction, that it is normal when you have a chronic illness. For someone who also has a chronic illness of something like diabetes or hypertension or high cholesterol or asthma, those all have very similar rates of relapse to addiction. And that is why we work very hard at focusing on reducing the stigma or eliminating the stigma associated with substance use, because it is not a moral failing of any kind. It is not just a matter of have enough willpower to stop. It is about a difference in the brain that we are addressing and teaching people how to live their life with support and to not just abstain, but to have a healthier lifestyle overall. But sometimes symptoms come back and people slip and they have use, they have breakthrough use or even a full return. So whereas people go into remission from chronic illnesses and they need to follow up with their doctor because maybe something's not working or their body's changing or their life is changing and they need help to get back on track. When people come back to us having completed a prior treatment episode, that's how we approach it. We want them to come in just like you would come into your family physician and say, I had an asthma attack. My medicine that I've been on is not working for it anymore, or my blood pressure is going up again. Let's talk about it. That's how we approach treatment when people do return to us. So we expect that there will be those who do complete treatment and don't have further issues with it, and then there will be those who will return to us several times. Either way, we're there for them.
So you don't have a program where you would once a year, annually, just call to see how you're doing?
We do call. We have between 70 and 120 days post-discharge, so that's almost, so a quarter after they discharge from us, we contact them, or we attempt to contact them, and we survey them and ask how things are going. And at that point, when we do reach them, if they need anything else, then we can always reopen them and meet them where they are at that point in time. And we also feel that when we give good service, that people, when they need us in the future, they will feel comfortable coming back to us and picking up the phone and calling us. knowing that they're not going to be met with shame or stigma, but that we're going to embrace them and meet them where they are.
Thank you.
Chairman, thank you. Ms. Burgess, a couple times now you've been before us, and I find myself pages and pages of notes and follow-up, which I will not keep everybody here with by any means, but what you and Audra are doing for this community, first of all, your approach, your facts, the way you deliver them, is part of the reason why you see some things changing for the better. Appreciate it. Keep that up. My question for you is this, and I think you've answered it. Dr. Rodriguez at the schools and Heather Galvin at the probate, two primary direct contacts to our future. How are you making out with them and inroads that way to get these things out there in programs? And yeah,
It's great. Great question. We value our community partnerships very much, and there's too many to name at the moment because I would be here for 20 minutes trying to list all of our community partners. But we do have a great relationship with the Beaufort County School District. I did not mention that we have a full-time counselor at the Right Choices Alternative School there to see students at that school. And we also have our prevention team going into the alternative school delivering prevention education. So that is an initiative that we continue to build that bridge with them. We would always like to offer more whatever the school district needs. And as far as probate court is concerned, they're a great community partner with us too. Our department does probate paperwork or orders, assists the petitioner in completing those in our office such that the probate court can then make a determination if there needs to be an emergency pickup or a non-emergency order for a person to participate in services. And then we assist that individual and the family through that process.
we, over the last number of years, we had the opportunity to work with and get to know Heather Galvin, and if she's got to be one of your strongest supporters, and I love it. So you mentioned the numbers, 137,000 and 127,000. Do you know what I'm referring to? How do you know your message is getting out there?
Great question. I've learned a lot from working with our communications director, Hannah Nichols. Thank you.
She's the best.
Thank you, Hannah. She's helped to educate me and my department because this has not been my primary area of expertise. But I have learned that we can measure or have metrics for how many people are seeing our campaign messages. Whether we do that on social media, we have a Facebook platform, and we launch out campaigns, we can boost those messages so that we know exactly how many people are seeing them, how many are liking them, sharing them, commenting on them. We also do radio campaigns, streaming audio on things that you would listen to with your streaming music, and those vendors can give us impressions, how many people heard the message that we put out on streaming audio, as well as on streaming video on non-cable platforms. So if you're watching Hulu or you're watching Netflix and you see those little ads pop up, we have vendors, currently we're working with WHHI, and they provide us monthly data on the number of impressions, how many people saw it, how many times they watched it through to the end, and many of our ads are not skippable. And then finally, we also have something called geofencing. And this was incredible when I learned about it, and a little odd at first. If you've ever gone into a store and wondered why suddenly on your mobile device an ad popped up, it wasn't a coincidence. Or a coupon popped up for the competitor down the street. That was not a coincidence. Geofencing allows the companies to put an invisible mobile fence around an area or a store, a location, such that when you enter that area, it will ping your mobile ID address on your device, and it'll deliver a message to you in the form of a text message on your phone. And we deliver those messages and receive the metrics monthly also. So those are our PSAs, public service announcements, on things like tobacco prevention for underage, or selling alcohol to minors, or for impaired drinking and driving, and what the laws are around that. So we have lots of prevention campaigns that always have the Beaufort County emblem and Nexus Cares emblem and contact information, so people see that and they also know how to reach us if they need any assistance.
We appreciate it, and on behalf of this council, if there's anything we can do, let us know, but thank you very much.
Thank you for your support.
Is there anybody else that has a question? I do have one last question. You mentioned the education piece several times with the middle schoolers in particular. Has the model shifted to more of a factual-based education compared to the scare tactics? I'm a product of DARE, and that didn't work.
Yes, absolutely. We did find out from years of research and implementing the DARE program, and I am of that era also, Chairman. I know from data that program was not effective, and in some cases may have done more harm than good. And we do not take a scare tactic approach to our education. It's factual, and it's really about building the type of skills that you need for a healthy life. How to communicate with your peers, how to ask for help, how to say, no, thank you, I'm not interested in using substances. How to live a healthy lifestyle and make good choices, which we know when you're in middle school, that it's a critical time when you're starting to make some grown-up type choices and then on into high school and adolescence. But the adolescent brain doesn't really finish developing till age 25. A lot of big decisions are made during that time frame. So what we really want to do is prevent people from going down the pathway that's going to lead to some negative outcomes for them, and to make sure that they have a positive, healthy, bright future. So our prevention messaging is positive, not scare tactics.
It's fantastic, and thank you.
Thank you.
Thank you for everything that you do.
Thank you.
All right, Audra, does that conclude?
Yes, sir, that
Okay.
concludes my report.
All right, thank you so much. Now we're moving into the Section 8 presentation and discussion items. 8A is discussion of Human Services Department transition to Nexus Care. Audra, are you coming back up? Come on down. Or?
We still had one ACA item.
Oh, I'm sorry. I'm sorry, John. Come on down. I'm sorry about that.
How are you this afternoon? John Robinson,
doing well.
ACA for Public Safety. I'm going to share with you some brief annual data as well for each of the public safety departments, and then answer any questions you might have. So we'll start with mosquito control. It's about to be mosquito season. Our folks have already been out there active. In calendar year 2025, the mosquito control department set 2,109 traps. They identified over 300,000 mosquitoes and sampled 1,825 standing water sites. So these are some standing water from all types of different things, whether it was a pond or stormwater pond or different things like that attract mosquitoes. Our folks go in there, sample those, and then determine what type, if there are any of mosquitoes are present, and then what type of application needs to be put in there to prevent those. So that's about 40,000 mosquitoes that were tested throughout the year, and the results of those 40,000 did not reveal any vector-borne diseases, which is very good for Beaufort County. That means the prevention program that mosquito control is working. All right. I do want to share with you that we conducted in 2025 21 aerial missions. Those aerial missions covered 100,000 acres, 98,000 and some change acres, which is a lot of property in Beaufort County. And we also did 265 truck-mounted missions, and those cover about 70,000 acres. The application through the aerial missions is so much greater and so much more efficient than the truck operations, but the trucks get places the aircraft just can't get. Some of the product that is used from the aircraft just doesn't get through the tree canopy to get to the right place, so those truck-mounted missions are really important. Check out our website. There's some new information constantly on Mosquito Control's website. Recently, there's a new chart and graph that shows you the types and number of mosquitoes that are identified throughout each month. And you'll see there's another chart on there that shows you some demographics with the area that has to do with temperature and humidity of the environment and the rainfall, those type of things, as to go along with the number of mosquitoes found. So there's some pretty interesting data there. Moving on to EMS. EMS in the calendar year 2025 responded to 22,108 calls for service. That's some busy folks. That's the average is 60 calls for service per day, and that's from 11 ambulances, 2 QRVs, and 2 supervisors. So 27 medics per shift responds to those 60,000 calls per shift. On February 14th, we EMS began the 24 72-hour shifts. There has been a few shifts that's happened so far. Things are working very well. We continue to have some vacancies, but because the new 24-hour shifts, we have more, I would say, new applications in-house. We have 10 vacant paramedic positions, and we have 4 that are right now, have just finished their in-house training, their ride-along program, and they should be going out to our ambulances in the next week, fully ready to go and do their job. So we spend quite a bit of time with them, making sure that they work with a field training officer and that they're prepared to go in the field before we send them out, not on their own, because they're always with pairs, but before we send them out in the field to perform their duties. Detention center. The detention center, here's some big numbers. The intake, just the intake of new inmates in 2025, 3,854. That's new arrivals. And then folks that released, that's about 10.3 per day for releases. 3,766 releases in 2025. We had, here's some disturbing numbers. We had 24 inmate versus correction officers assaults, 25 inmate on inmate assaults. So these are what's called a code red. If something goes on inside the detention center, that's that alert. 114 uses of force, as we make sure that we document everything that happens in the detention center. And a lot of those result in an in-house disciplinary hearing. So some issue happens inside the detention center, that inmate will go to their own disciplinary hearing. We conducted 827 disciplinary hearings. Some of those result in some additional time or loss of freedoms that they may have inside the detention center. Okay. Let's see, the staff managed 775 inmate visitations and 4,500 video visits. Let's see, animal services. Our animal services has space for 100 animals, for 100 dogs, that is, and about 140 cats. We began 2025 with 116 dogs in-house, and we ended the calendar year with 99. So we had 1 kennel left. If you went to the animal shelter, you would see animals in kennels in the hallways, and behind the admin staff, there's a long hallway full of animals. So we've done really good to get that number back into check. And a lot of that is done through work with fosters. We have many animals, cats and dogs both, out for fosters with members of the community, as well as some of our partners. So we partner a lot with the ASPCA and with other local animal rescues to move those animals from our shelter after they're healthy and cared for. We move them out to other partners for adoption. So that's really important for us. That was 1,593 animals that were transferred out to other agencies for adoption. So that's really important for us. Fleet services. Fleet services, this in 2025 processed 2,777 work orders. Beaufort County, or the fleet services manage just over 1,400 assets, Beaufort County assets. So anything from vehicles and equipment to lawnmowers and golf carts and you name it. If we own it, it's got wheels or a motor, fleet services manages that. The average work order, so from the time there is a complaint logged in the system to the time the asset is repaired and back in service, is 9.06 days. Which is pretty good for a fleet that size with 9 technicians. They serviced, just in oil changes, 876 oil changes and air filters, for example. So you think about how many times per year you take your vehicle in, once, maybe twice, and they have hundreds and hundreds of assets that need this preventive maintenance service. Preventive maintenance is the key to a healthy fleet. If we keep up on our preventive maintenance, we reduce downtime, we improve the equipment quality, we improve its value, so that if after its years of service it still has residual value, we can auction those items and recover some of those dollars. If we have a piece of equipment that hasn't been maintained well, time it goes to auction, it's not worth as much. So that is very important to what we do. There's lots of other metrics here, and I'm happy to share those with you, but I just want to give you a snapshot of what your public safety departments are doing for you throughout the year.
Thank you for that update, John. Are there any questions?
I had a question.
Yes.
Yes, ma'am.
And do you know the average stay in the detention center?
Yes, ma'am.
Okay.
I'll look at that number for you. It was 14, but we have reduced that to now the average length of stay is 8 days. Our average daily population, it changes throughout the year. Right now, it is 227. The high for the year was in November, and it was 237. The low for the year, sorry, I got a lot of data.
Well, that's interesting, yeah.
The low for the year was 134,
Okay.
and that was in April of last year. As you know, our jail was built in 1992. We continue to do lots of work inside the jail. Our facilities team and CIP team spends a lot of time making sure it functions as it should. We have, right now, our maximum capacity is 255. So with 227 inmates, many of those inmates require a single cell. We don't have very many single cells. So when we have an inmate that requires a single cell, that removes one of the beds. So while we have 255 beds available, that doesn't mean that there's always space in the inn. So folks get piled up in there sometimes. You're welcome.
Real quickly, yes. You mentioned detention center, and
Yes, sir.
I'm not too sure whether I'm aware that we do not have. Are we still? Have you brought the inmates from Charleston back in?
Oh, yes, sir. Many months ago. Yes,
Many
sir.
months ago. Thank you, sir.
Yes, sir.
And I'm glad to hear that under the mosquito control that there was no disease vector out there and stuff. So
That's right.
Yeah.
None that we found. We sampled a lot of mosquitoes, but there's more than we can touch. That's for sure.
Thank you.
So,
Yes,
Mr.
ma'am.
Robinson, two things. One, mosquito control. I signed up for alerts, so I find that very interesting. And I put it all over our Facebook pages, so
Thank
God
you.
knows how many people signed up. The second question I have has to do with animal services.
Sure.
We have that MOA with Jasper County.
Yes, ma'am.
So I know they're up to date on their invoices, but what progress are they making as far as, I think the MOA goes to the end of June? Sorry. The MOA goes to the end of June, correct?
It is soon. I don't remember the date. but
Whatever it is. Are
yeah,
they making
it was-
progress to solving their
Yes.
issue?
Yes, they are. So I learned this week that they hired their staff, and that was the critical step for their county to hire staff, develop their organization. So we are taking those steps back. And when I mean Beaufort County, we don't have to support them for staffing. We're helping them continue the transition, but it will be very short order that need anything from us but to help answer questions. But they'll be able to manage their own organization.
But have they, I've seen where they place their dogs. Have they improved that facility? Because
Oh, it's dramatically different than it
I
was
haven't
last
been there
year.
in a while, so it's dramatically better.
Yes, it is. It is still the same facility, but throughout this many months, they have also helped to invest some money in that facility. It is completely different than it once was. It's clean. It's healthy. It's a good environment for the animals. It is still an outside environment.
I was going to ask that, yeah.
So there is some work to be done, but they're in a very good position.
All right, I'm glad to hear they're making progress. I was concerned that their dog cages, I'll say that, are outside. So when it rains, there were issues with mud, flooding, that kind of thing.
They did, when it comes to the outdoor facility itself, the care of the animals is, when it comes to drainage and runoff and those kinds of things, is really critical because there's other bacteria and diseases that can remain in the ground. So we did have many partners who donated their time and donated things, rock and labor, to clean up that area, make the drainage work properly, and then installed some ventilation fans, so some fans in the outdoor kennel, and that's helpful to keep air moving. And in the wintertime, some heaters that are also in there to help with that. We had a really great company from Ohio that built some all-weather dog houses. Now, we had to pay for those. We didn't pay for them. Jasper County paid for those, but did an excellent job and brought those into their kennel to really improve the environment that the animals were in. And I think we reduced the number of animals there to from well over 100 animals to around 40. So taking the pressure off of that environment really helped.
Mr. Wilson.
John, thank you for your presentation.
Yes,
You spoke briefly about the standing water issue with the mosquito population. And unfortunately, last year, we had some mosquitoes that I've never seen before. I mean, they were humongous.
Big ones.
When they landed on you, you felt it before they even got a chance to, yeah. But anyway, as far as standing water is concerned, we have an educational process, I think, on our webpage, app to address standing water as far as private property and private homes are concerned.
Yes, sir.
What are we doing to address the standing water on roads and highways where that contributes to a lot of our mosquito population as well?
Well, thank you, sir. Hopefully, in drainage ditches and those things, they dry up quickly, and that's moving water. But any type of standing water, if there's a complaint in that area, what we do is we try to be careful with chemical application because you don't want to just overdo it. So what we do is we start with a sample. We take a sample device, we set it up in that area. We'll take a measurement over a few days. We take that sample, we identify that.
And the roadside ditch, but it's state, it's not the county. And so I've reported that and tried to get some action on it, and nothing has happened to this point. So I'd like to get with you after the meeting today and discuss that if I can.
I can share with you a document that we've shared a few times. I'll make sure that we share it with all of council that has several different ways for citizens to get in touch with mosquito control and more or less offer a complaint or a request for service. There's a website, there's a telephone app, there's a phone number. There's so many different ways just to contact mosquito control and let them know that there is a problem, and they will send a team out immediately. We had tried to address those very quickly because it's much easier to prevent that problem than it is to take care of it after mosquito larvae hatch.
One last question.
Yes, sir.
You gave us an update on the detention center.
Yes, sir.
I was out of town when Colonel Grant retired, and we had the ceremony here for her. I was out of town, so I missed it, but I did call her personally and thank her for her years of service. Following up on that question, who's our new director at the detention center now?
Well, thank you for asking. Today is Colonel Grant's last day. so she is in the detention center right now.
Okay.
So in the interim, we have our detention center deputy director who will manage daily operations, and I will be in the detention center to manage all of those things, answer all the questions that the colonel would normally be responsible for. I will assume that responsibility until we have a new director in place. That would be the normal chain of command for the detention center. We have posted that position for well over 30 days now. We've received several applications, and we are in the interview process right now. Thank you.
Keep us posted.
What's that?
Keep us posted.
Yes, sir.
Is there anybody else that has a question?
I have one more.
Yeah.
Did we do anything about pay for the detention center workers? Remember we had this big discussion?
Yes, ma'am. We are in progress right now. We have developed a compensation. We have completed a compensation study. We have developed a compensation plan, and that is on our meeting list for the week to get through that.
Oh,
There's hope to retain more people and get more people to work in the detention center.
Yes, ma'am.
Okay, thank you.
as a follow-up, what's your vacancy right now
Well, right now, we are
at the
the
detention
number.
center?
Yes, the number of folks we should have are 79. So we have 79 funded positions, and we have currently 33 vacancies.
Still.
Yes.
Thank you.
It is a lot. Anything else?
I do have one question for you, actually going off what Gerald mentioned with the standing water. How much of what we do is the chemical intervention, pesticides, versus a natural intervention of stocking a pond or something along those lines? Do we have any program like that?
Well, so mosquito control is very restricted. So by the state, there's a very specific regimen of allowable products. So to say that the products we have are organic, they are not. There are some chemicals that are more caustic than others. So the adulticide is a more, caustic is not the right word, but a more harmful product than a larvicide. However, the volume of this material is fractional. If you think about how a adulticide works, you have to aerialize this chemical in such a small drop that it's intended to touch a mosquito to kill it. So when you make this airborne, this is such a super fine mist. We're talking micrometers of size of droplet in order to touch a mosquito. The aircraft 200-gallon container, 200 gallons of water in the container might have a few ounces of adulticide. So it's not much that's out there.
So, I mean, going back to the question though, is it all the chemical intervention, or do we have anything that's like I said, helping with stock ponds with
Like a fish or butterflies or whatever
Yeah, something
eats
to
mosquitoes,
naturally-
birds.
yeah.
That is not something that mosquito control manages. Now, we would encourage citizens to do that, but that is not something that mosquito control manages.
Thank you.
Chairman,
Oh, yes.
I just want to make a comment that ever since I put my bird feeder in my window, I don't have any problem with mosquitoes and stuff. So I don't know whether it works or not, but I don't have any mosquito problem in my yard. Thank you.
There are some natural things out there, birds and different types of fish and bats and those kinds of things that are certainly helpful.
Purple Martin House.
But they don't, yes, but they don't cover hundreds of thousands of acres of land. They might
They
be
help.
good for your yard.
They help.
We've got all of Beaufort County to protect.
Thank you so much.
Thank you.
Thank you for the update. All right, is there anybody else? I don't want to miss anybody else coming forward. All right, cool. All right, moving into 8A, the presentation of discussion items. 8A is discussion of Human Services Department transition to Nexus Care. Audra and Pinky, are y'all coming on down? The time.
Good afternoon again.
Hey.
I didn't know if you'd want to speak about the financial component first and have Pinky speak, or
It's completely up to y'all. Doesn't matter which order for me. Since you're standing right there, you want to jump into, I guess, the transitional phase and kind of what you expect out of this?
I think part of the backup was the org chart of what we're looking at for this integration of the human services into Nexus Care.
Can I get the, Sarah, you putting it up there? Yeah. Okay, thanks.
Thank you. I think it's important to note that, in looking at this org chart, there is no wrong door approach, and I'd like to communicate that, that regardless of an individual that might need services for alcohol and drug, no one will be turned away.
On the work chart to go up?
Okay.
Is that?
Yep, there.
Okay.
Rebecca and I have worked on this. She did a lot of work in creating this org chart to integrate the human services in the existing framework of Nexus Care. See that 2 of the positions from human services will move over to Nexus Care, and that will be the deputy director.
Speak a little louder.
Yes, sir.
Thank you.
Like I said, the 2 positions from human services will fall under Nexus Care. That will be the deputy director and then the care coordinator. That is to ensure that the programs will continue with this integration.
And I was going to ask, can you explain how, like, kind of what the role both those parties are going to play in this?
Actually, I think what I'd like to do is bring Rebecca up here.
Yeah, sure.
I think Sarah, earlier today, she emailed the flow chart. I think if Rebecca gets up here and explains the structure and the flow of what we're looking at, I think that might help a lot. And then any questions you have with that flow chart, she will be able to answer those questions. Rebecca?
Can we see, yeah,
Yeah.
see
Okay,
that
Sarah.
flow chart, because it came out
Or do you want me to
today.
use this, or you can? Okay, great.
As Audra stated, Nexus Care has a point of entry that is no wrong door, meaning that anybody who contacts us, whether it's their self or there's a formal referral process, we take those by phone calls, walk-ins during office hours, fax, email, and means through our website for people to reach out to us. Such that whether they come into our agency or another community partner agency, that we have referral processes in place with those organizations. So once a person comes in through the point of entry, through our doors, they go through a multidimensional screening process by which we're able to triage what their needs are. The multidimensional screening covers really all the social determinants of health care, including a person's immediate safety, whether or not substance use is involved, if there are medical issues, mental health issues, a need for food, transportation, housing, education, vocation, and support systems. When the screening is completed at the point of entry, then we triage it. If we identify an immediate safety need, it goes into crisis support. It is handed over at that point to a member of the clinical team. These are licensed and certified mental health and addiction counselors, as well as a treatment director. They would take over if the person is in an unsafe situation, at risk of hurting themselves or someone else. If there is imminent danger or child abuse, neglect that needs to be reported as part of mandated reporting, or if there is a need for probate process Sometimes this involves working with our law enforcement and emergency responders. It can also involve working with the mobile crisis team at Coastal Empire Community Health Services, depending on the nature of the situation. Once crisis support is provided and that is resolved, then at that point, we go back to deciding, was there substance use involved or not? If there is substance use involved, even if it is tobacco use or gambling of any, in that context, it moves into clinical care. The person is scheduled for an intake and a clinical diagnostic assessment that is very thorough and in-depth. It's about 20 pages of content that assesses pretty much every person's life in detail. As a result of that diagnostic assessment, then we provide an individualized treatment plan for care that includes components based on need. It would involve counseling, medication consult, whether that would be for primary care medications, mental health medications, or substance use treatment medications. There's also peer support, and then for those who have complex needs, targeted case management, which is the role of the care coordinator on that org chart. The care coordinator works as a part of the clinical treatment team, and they would provide wraparound targeted case management, working with community partners through the treatment process. And then we follow up with an individual after discharge from services, again, 70 to 120 days to evaluate how they're doing and if they need anything else from us. So if at the point of screening and triage, there is no substance use involved, our current process is to provide information and referral and follow-up. What we do not have currently is the 180 days or longer of wraparound care coordination. This is where there's no clinical care indicated for us to provide. However, there may be, with their other needs, what we would call a warm handoff and referral process to our community service organizations and other state agencies. For example, under the 2025 piece of legislation that enacted the Department of Behavioral Health and Developmental Disabilities at the state level, that cabinet brought under it the Office of Substance Use Services, the Office of Mental Health, and the Department or Office of Disabilities and Special Needs under one administrative umbrella to remove the silos and barriers at the state level, with the intent that that will trickle down to the local level, such that we're working so well together without barriers between us, that we can really have an integrated flow of care. With that, our agency partners that are part of the state system, the Office of Mental Health or Coastal Empire Community Health Services, and Disabilities and Special Needs, and some other organizations in our community provide wraparound care coordination. And most of these people would fall under that category. So we would provide information, referral, warm handoff, and follow-up, trusting that our community partners would be able to provide for those needs. So that would be one of the differences. And with that sort of outlines what the point of access looks like for people coming into our current infrastructure. This would not be the shift of the Human Services Department under Nexus Care's umbrella to continue to do exactly as it currently does as a division of Nexus Care. It would be fully implemented within our existing framework, such that we would continue to do what we currently do.
Mr. Chairman?
Yeah, go ahead.
Could you repeat what they did at the state level again? How that impacts us locally?
Yes. At the state level, the governor's office ordered a survey done by the Boston Consulting Group. And The outcome of that survey was that South Carolina had a very fragmented care system, a service delivery system, because we had these silos of things like the Department of Alcohol and Drug and Other Services, and the Department of Mental Health, and Disabilities and Special Needs. And so this new cabinet was created, the Department of Behavioral Health and Developmental Disabilities, or BHDD. Under there, really, is the Office of Substance Use Services, which is a state pass-through for federal and state legislative funding to our local systems. Also, the Department of Mental Health is now called the Office of Mental Health, and the Disabilities and Special Needs, Office of Disabilities and Special Needs is there as well. So they are all under the same administrative umbrella to remove barriers and to work together more seamlessly so that we don't have that fragmented care system in the state of South Carolina. That was to follow the recommendations of that Boston Consulting Group's report.
That's been
to the
fully
governor.
implemented at this time?
It has been fully implemented at this time. And we are tasked with working together with other state agencies and community partners to ensure that seamless care between us, so that we are having multidisciplinary team meetings. For example, if a person comes into Nexus Care and they're in clinical services, part of that process involves multidisciplinary team meetings, which is something sort of similar that the Connect meetings we're doing are doing with Human Services currently. Those multidisciplinary meetings invite people like from that are also involved. The Department of Social Services, DSS, Office of Mental Health, Coastal Empire, Disability Special Needs. So whoever are other providers in the care of that person, we're looking at the whole person's care simultaneously so that we're not treating them or providing services clinically in a vacuum. And it's working together for the outcome that the individual needs or the family needs. So that's the key difference, is that we're really looking at what we can do to expand our partnerships and embed services in other places and make care more accessible, and so not so siloed between that's mental health over there and that's DSN over there and that's substance use over there, but to make it a more integrated approach. And we're also tasked to work toward implementing primary care as much as we can. And we have community partners, for example, like Good Neighbor Free Medical Clinic, that both Human Services and Nexus Care work with, who do provide wraparound targeted case management, just as we do. And I believe that Disabilities and Special Needs, as well as, and I know that the Office of Mental Health, they have a whole team of care coordinators, and we will too. So that a person would not be getting targeted case management from two agencies at the same time. The patient or the family would choose a case management home. They would choose one organization to do all of the coordination for them on their behalf, and to help navigate the process, rather than for us to have different agencies not knowing what the other is doing.
Thank you.
Yes, ma'am.
Mr. Glover?
Yes, Ms. Burgess, help me understand how the mission of Nexus and the mission of Human Service Program interconnect. I mean, how do you bring the two together to form it seems to me that the buzzword you use is the integrated approach. It seems to me that the Human Service Program actually was doing that integrated approach to helping a person, and they brought the wraparound services because they were all in the community, making sure that those type of services can be applied to a patient. And making sure that they were being their needs were being met, although it was not coming from one agency, but it came from a vast majority of community services. So to help me understand how those services will be provided under Nexus, that's currently being provided now. So how do you fold that into your program, what they're doing, and they're not being diminished? The way I even see the organizational chart, I don't see that services being provided, the outcome. So help me understand how you bring the two programs into one, and the outcome is satisfactory as is, or better than what is currently being done now. So help me understand that. Thank you, ma'am.
It's a very complex question, sir.
Okay, and you don't have to answer it right now.
I'll do my best to answer your question. So there are, of course, very similar processes for what Human Services does and what Nexus Care currently does. There are a lot of things that we do very similarly. They also offer the multidimensional screening when someone walks in or is referred to them. And then they also establish what the needs are. And they come up with a complex care plan for that individual family, such that then their program is to connect them to services that are provided by other organizations. So they provide the screening and the evaluation service, and then they connect them to other organizations that provide what an individual or family needs. We also do that. One of the key differences is that our focus is on if there's substance use indicated, it goes into clinical services. If there is not, then we still provide the individual family with the screening and information, referral, warm handoff to other agencies, so that then they take over the care. What Human Services, is my understanding through meeting with Mr. Boswell, is that the Human Services team provides wraparound case management for those individuals for 6 months to ensure that they've made those connections with, and they had those connect meetings, which we've been a part of. Nexus Care team has been part of the connect meetings, which were formerly COSI and COSA. And so that is how we would integrate that. Also with the REACH program that currently exists under Human Services. The REACH program for unhoused individuals, as we know, there's a lot of need for that in Beaufort County. And they currently have the Outreach Systems Coordinator position, which we would be able to, under Nexus Care, we would be able to continue to enter people into HMIS, Homeless Management Information System. And typically what we were doing anyways is we would have an unhoused person, we would just walk them down the hall, a couple doors down, to Human Services, so that the Outreach Systems Coordinator could enter them in the system and take a look at what their needs are, if the person chooses that. Not everybody chooses that path. And we worked closely side by side on a lot of cases that way, just sort of walking one down to each other's office between our doors and theirs. We would continue to do HMIS and maintain that database for people in Beaufort County who come through our no wrong door approach. So we would be able to sustain putting that data into the system. And that data is critical, as I understand it, for the purpose of meeting the current needs and then looking at the bigger picture and possibly if there's opportunities for funding and things down the road to meet those unmet needs. So that's what the two primary programs, Connect and Reach, under Human Services can look like within, and I don't want to say under the Nexus Care umbrella, because we're not just moving a department over, we're integrating it with what we currently have, so that we are sticking to our mission, as you said.
Sure. I think the key is that you have a mission, they have a mission. So I'm going to ask this question here, and I want you to be truthful um, you sat at the table, and the Human Service, you were one of the agencies that sat at the table providing the wraparound. Did you see that your services and the Human Services was a duplication?
As I said, at times we do things so similarly that we have to then make a determination who's going to take over at that point.
Right.
Such that if they got the initial referral and then they had the connect meeting and we were invited, then they handed them over to us. We had the capacity, once the person or family became under our care, to provide care coordination.
Because you were the right program for that.
Yes.
Yeah,
Yes.
okay.
But we also do coordinate care with other community partners, just as Human Services does. So we did see a lot of similarities, and at times, I don't want to say duplication, but we have to make a decision, as we always do, with other agencies that are providing care coordination, just like the Office of Mental Health. If they're getting that through their or Good Neighbor Clinic or another state entity, then we have to decide who is going to be the one providing the care coordination, inviting the other people to the meetings, to the table. For example, we have clinical staffing every Tuesday afternoon, and it's virtual, and we do invite other providers to participate who are involved in care. Of course, it is up to them if they're able to hop on those virtual meetings and do those clinical staffings with us and give us updates on how care is going within their organization on their care plan, so that we have a coordinated effort. It can be challenging to navigate that, to have multiple agencies all working together, but that is the end goal, is for one agency to coordinate. And Human Services was coordinating those connect meetings so that they could get people connected, and then at some point they're able to then say, okay, we've done our part, and now it's up to those service organizations to continue the work once we've connected them.
Right, and that's what I understand the Human Service Program does. And at some point in time in this county, there was a need for that. This council here saw fit to fund the Human Service Program back in before my time, so it was some time ago. And that program has been as mirth into something that has been very beneficial to this community. They increased staff a couple years ago because this council was concerned about some clinical issues that were out there, people who were not being served. So they increased staff. Since that time, I've not heard of a lot of problems in the detention center or at the hospital, or folks actually walking the streets or whatever. I have not heard that. I mean, I'm not saying that it's not there. I just hadn't heard that. So to me, it's been a good thing. And I just want to make sure that service is will continue, and that we do not leave anybody behind. And that's what I saw Human Service Program do. So that's where I come in from, and that's where I am. Thank you. Audrey, you want to say something? Please do.
I would.
Yes, ma'am.
And you heard from Rebecca's report that her and her team, they care. There will be no individual that falls through the crack, no family that will fall through the crack. And that framework, that foundation of the Human Services, it's there and it will continue. And Rebecca and her team will continue to grow. So not only did the Human Services Department grow from one individual to 5, but you'll also have the team of Nexus Care that will be able to contribute and continue that connection with the individuals, whatever they need.
Is that a guarantee? Or, I mean, are you guaranteeing that, or it's just a statement you're making? You know, nobody will be left behind, but you're going to make sure that you put the infrastructure in place to make sure that all those needs, as much as that can be met, will be met.
If the individual wants that, yes. It's their choice if they want to move forward and receive those connections. If they want that, we will do our best to make that happen. That
But you
will
also-
continue.
You do know that there are individuals that may not want it, but it's best for them, and you have to pursue them. I mean, it's,
We can't force them, but
no,
we
you can't. I
will.
understand that too,
But we
you
will
can't.
make sure, just like now in human services, we can't force any individual to, we make the connections to provide those services to community
I understand you
partners.
can't force anyone, but
But we will let them know that it is there. We can make that connection. We can work with those families. We can work with those individuals to make
instead
those
of letting them
connections.
know, I wish you would say that you will make sure that they do not fall and that we provide the care, because sometimes they can't make the right decision for themselves. But, sometimes you just need to, hold people's hand every once in a while. But anyway, that's just me.
That's what the care coordination, that is what it is designed to do.
I'm somewhat confused. This is a discussion of what you're proposing. What are you looking for from us? Do you want input of how this organization chart should work? Are you asking us to say yes, no, maybe? This is an administrative decision. You are the professionals who are going to make this task work. I have a couple questions. Rebecca, when you announced before you had 28 positions, this chart shows 30. I'm assuming the 2 positions that came over make it the 30. That's number 1. Number 2, I see on the chart there are 3 individuals that have nobody that reports to them. To me, that's not a red flag, but a bit of a concern. Next, there is a person who is an alcohol and drug professional that is not with the others. So the question would be, why is that person under a different person? Are they doing something different, even though they're considered an alcohol and drug professional? So those are the only things I would be concerned about. It's what you want to do with this, how you are going to run this program efficiently and effectively.
Pinky can speak for the financial component, and that's when all this, came to fruition, is that, the department is a special revenue fund. And when we were approached with this and speaking with Mr. Moore, how can we best continue these programs and not lose the continuation of these programs? Because we know it's important. It's been in existence for many, many years, especially COSI, that is now Connect. REACH is fairly new. But that was our goal, is to, how can we integrate these programs into another county department and have them continue to thrive? And that's what, I have done. Meeting with Rebecca to make sure that those programs will continue in Beaufort County.
Before we get to the financials, a couple of weeks ago, Chair Howard, Vice Chair Tab, and I had a chat with council in Beaufort, and we met a bunch of these folks here, and they asked these questions, and I think you answered well, and I think Rebecca answered well about integration. I heard about, we're not going to lose people through the cracks, the families. That's a great thing. What are we doing about the people that were part of human services? And I think Mr. Passman talked about a couple coming over. Are those discussions that we talked about at council, did you guys get together? Did you talk about those issues you had? And how did those talks go? I mean, that was 2 weeks ago.
We did. I thought that meeting, there was some concerned citizens, and there are a couple in the audience this
Right.
afternoon. I think it was a good meeting. I understand their concern. Administration understands their concerns, but I honestly think it was a good meeting.
Excellent. That, to me, we heard a lot from, is it Lolita and all that really brought up some stuff, and others. And Just want to make sure we connect, that's all. And I think integration about what you talked about, I think you did that, I hope. Does that make sense?
It does, and I will say that Nexus Care is in the Human Services building. The Human Services Department is in the Human Services building. That will continue. You know, they will stay in the building. And like Rebecca stressed and I stressed, there is no wrong door.
I love it, thank you. No, this is good.
I do have a question. Joe, this is kind of piggyback on what you're talking about. So I guess part of this was to see if there was or help shape a formalized plan to transition the human services into the Nexus Care. But my question is, the current caseload of human services, is that coming over to Nexus, or is that currently in the process of being offloaded?
We are evaluating those active cases, and so if they still need connections, follow-ups, that will continue to happen. I'm working with Rebecca right now and Ben, the director, to look at those cases. Rebecca met with the individuals last week, so we're looking at that right now. So just because the integration will happen, that doesn't mean that the cases will stop, and we won't follow through with those active cases.
Yes, Mr. Dawson.
If I might ask for some clarity, I think I can speak for myself, but I think the council the committee as a whole, we weren't clear on why the consolidation was being made. And so we wanted to have this discussion, to have staff explain to us the need to integrate the programs from Human Services over to Nexus. Over the years, County Council has funded what we called outside agencies. The outside agencies were these agencies that were outside of the county operation that we funded for the need and the cares of our citizens. So when we heard and understood that the integration was being implemented or being suggested by staff, then we needed clarification. I needed clarification to make sure and understand that if these programs that are in the Human Services, under the Human Services Department, are being integrated into the Nexus, then we want to make sure that no one falls through the crack. We want to make sure that all those agencies are transferred over and continued. So I saw in the beginning of the presentation where it talks about two employees being transferred over to Nexus, Boswell, and I forgot the other young lady. But weren't there 3 employees in the Human Services Department? What happened to the third one?
There's a total of 5.
Where are the others?
Well, I'd like to clarify, for what you're speaking about is the Community Services Grant Program, and we plan to put that on our budget, and so that will move forward, you know, if council desires to fund that Community Services Grant Program. And that's the allocation of funds. It's a grant that is conducted every year. 501c3s that qualify, they're able to apply for that, and it goes through council for approval. That will continue. We still plan to budget for that.
Okay.
As far as the positions, with this integration, unfortunately, 3 of the positions were eliminated due to this integration.
We lost 3 employees. The employees that are transferring over to Nexus, have their salaries remained the same? Yes or no?
Yes.
Was it increased, decreased?
Well, due to the recent comp and class to fit the pay grade, it was actually an increase. A step to the step that council approved.
And I think Joe, try to get some clarification beyond just trying to understand the decision. I'd also made a request that the job descriptions come into the backup material to help us understand what Human Services was doing. I did notice it looks like the Outreach Systems Coordinator was not listed on here for the backup material. Can somebody explain what that role is currently?
I don't know why it wasn't in backup, but it's a lot of the duties are the same as what the care coordinator with this integration will be. To make connections for the individuals that need services for our community partners.
And my only other question, which will maybe segue into the finance part of this, Does Nexus currently have a contract with the SC DHHS?
No, they do not.
Are they planning on renewing that contract that we currently have? Because it's good through, I think, June 30th, 2026.
Correct, June 30th.
Okay.
No, we do not plan to continue the contract, which is a matching grant.
That's a Medicaid grant, isn't it?
Yes,
Or-
that's correct.
okay. I think that segues into the finance portion of this. Thank you, Audra. Did anybody have any questions, additional questions for Audra? No?
Well, there were, with different classification numbers, there was a human service director, David, and then a 316 and a 318, I think. So I'm not sure which one were you saying was missing?
The outreach services, outreach systems coordinator, I think is what it was called.
Yeah, I think just one of the job descriptions was left out of the backup on accident. I don't think it was
There's
intentional.
3 in the backup.
Yeah, I think
There's
what you asked, what you asked for was the current positions in human services and then the 2 positions that will be integrated into Nexus Care. So there should have been a total of 5.
Yeah, I think there's only,
I mean, 7,
There's only-
actually.
okay, I think I see 4.
Yeah. By title, yeah, 4. Okay.
Thanks. Vicky, you're up.
Well, I'm kind of really glad that you said effectively and efficiently, because that is the purpose of what I'm responsible for, which is your general ledger. As I mentioned at the budget retreat back in in November, that we were taking a deep dive into special revenue funds this fiscal year. We had several that ended in the red in fiscal year 25, and in order to avoid an audit finding, I was going to be looking at several of them. This just happens to be one of them. We have others that have much bigger problems. For example, the Defusky Island Ferry contract, that is a special revenue fund. All we're doing right now is taking ad valorem taxes and moving it into a special revenue fund. That is not the function of a special revenue fund. We're doing exactly the same thing in this case. And in this case, I'm not going to speak to the program because that's what these wonderful ladies are for, but it happened to fit well here because alcohol and drug is already a special revenue fund. So instead of taking it and moving into a general fund, they were able to merge services together for, I'm not going to say duplication, but similar services being provided. But for the financial side, we do have to address the fact that it has ended in the red for multiple years. The backup is in your, or the reports are in your backup. As you can see, 49,100, which is the transfer in, it has steadily increased its transfers in from fiscal year 2019. These are actuals, by the way.
Can I pause you real quick and see if the clerks can pull that up for us? And please, I hate to say this, I'm a lawyer, not accountant. Can you go through that?
I will do my best to dumb it down, okay?
Thank you.
Really?
Hey. I can sue you, but I'm not good at math.
So the contract you were referring to earlier is right there in 47620, which is the object code. It says contract revenue. That is the South Carolina Department of Health. Thank you. These girls know the acronym better than I do. That is offset by the expenditure, which is down at the bottom, which is 55,000 direct subsidies. We have to budget that match in order to get that 197 up top. Does that make sense? So of that 197, 103 is of your own money, which is coming from the general fund. So that's the only way we make that contract revenue, is if we don't match it, we don't get it. Does that make sense? The other one is the transfers in right below that, the 49,100. Those were funds in fiscal year 2019, was 181,000, grew to 186, stayed flat for 21. Remember COVID, not much was changing in that time frame. Jumped to 225, jumped to 346, and then year-to-date actual in 25 was 191, but we have a little over 400,000 budgeted for fiscal year 26. And I think there was an increase of 1 staff member, is that right, Audra? I'm speaking for a year, I wasn't here, sorry. But anyhow, as you can see, it has just steadily increased over time, and which is adding to the negative fund balance. So in order to address this, I brought it to the administrator's attention, this plus other special revenue funds that were finishing in the red year after year, and that we needed to address. And in this case, it seems like the merger between Human Services and Nexus, I still call it alcohol and drug, but seems to work as a better fit because they're able to provide similar services. I know this is a lot of numbers and a lot of, these are their year-to-date actuals for every fiscal year since fiscal year 2019. The yellows are a few anomalies. In fiscal year '22, we only received $55,000 from the Department of Health and Human Services contract when we budgeted 98 for the match, but did not spend it, so that is why the fund balance in that year is a positive number. In fiscal year '23 and '23, the match was submitted to the state for the SCDHHS contract, but in fiscal year '22, we only received 96. In fiscal year '23, we received 103. So as you can see, that's when it started going negative again. I'm happy to answer any financial questions about what I've just said.
Oh, yes, sorry.
These grant funds from the state, any other county receive those in the state?
Not very many counties have human services. I worked in another county and we did not have a human services department at all.
So these are special,
So, Audra, do you know?
maybe I'm asking a question we don't know. We just apply for them. Is that? You see what I'm?
I do. I mean, it is a contract, and that contract is a matching grant. I can't answer if any other county in the state of South Carolina is doing that. I would guess no, but I can't definitely say that they are or they're not.
But we don't receive it unless we match it.
Match it, correct.
Got it. Okay. Thank you.
Yes, sir.
Chairman,
Yes,
quickly. Ms. Harriet, so I understand the line 49,100 to transfer in, what money is that?
That is the money coming from the general fund, from your ad valorem taxes.
But that's county appropriation.
Yes, it's
Okay.
tax revenue
Just-
collected.
Okay. In addition to the the transfer in, and then you have the direct subsidy?
Yes, that is the matching to the contract that Ms. Audra was just talking about.
Right. For me and Dave, help me to understand. So we putting in to this program the transfer in as well as the subsidy. So that's roughly $400,000 coming out of general fund?
For '26, it's more because we added an additional position to human
I'm
services.
just taking I'm actually taking 2019. So I'm just adding up the transfer in and the direct subsidy coming from general fund. In essence, it's coming from general fund.
It is coming from general fund,
Okay.
correct. It is coming from general fund. The 103,000 down at the bottom where it says direct subsidies,
Right?
that is included in the 197 up at the top where the revenues are, because if you don't pay the 103, you don't get the contract revenue from the state.
Oh, okay.
So you're
that's-
paying 103 to get the matching.
Okay, so the direct portion is really 103 minus the 181. That's coming out of general fund.
No, sir.
Oh,
The 181 is the transfers in coming from the general fund, but the rest of this
no,
this
I'm sorry.
budget.
The contract revenue, the 197, that's coming from the state. That
You
includes.
take the 103 from that.
Take the
So
103
really
from
you're
that.
netting-
Right. Okay, that's what I was getting after. And so we have a program that we want to have that's really not costing us a whole lot of money. But let me stop right there. Let me go to 22. We did not send any direct subsidy in that year?
We did not. We budgeted it, but I can't speak to what the answer to that is, but this is based on what was recorded as revenue and expenditures. We did not expend the funds, but we did collect $55,000 from
From the state?
DHHS.
From the
yes.
contract? But
Correct.
we did not send any matching funds at all? So we
No,
didn't?
but if you look at the very next column where you see 200,520,
Yes, ma'am?
that's both fiscal year '22's expenditure and '23's expenditure.
Oh, okay.
It's fiscal year '22 and '23's expenditure. That's why it's 200,000.
Which lines, I'm sorry?
The very next column, under '23,
On the bottom.
the one that's yellow, 200,000 at the bottom.
But in
520.
In '23, we didn't get, let me see, hold it now.
And we got no revenue in '23.
Something happened there, right?
Yes. I'm not going to speak to what occurred during a year I wasn't here, but we didn't record any revenue, but we spent 22 and 23's funds in fiscal year '23. And I think there's some timing with some revenue or invoices. Is that right, Audra?
What happened?
The timing of getting invoices from the state seems to cross over sometimes in fiscal years, which is probably why we paid 22 and 23 in fiscal year '23. But unfortunately, we did not collect any revenue that year.
That's what it looks like, right. And I'm just
Right.
wondering why those 2 years, which we should have gotten contract revenue for 2 years, roughly $400,000, we only got $55,000. So that's where your deficit came in, right?
It started in fiscal year
22.
22, well, ending
Right.
23, really, because you
Yeah.
paid for 2 years, but you did not receive revenue from the
And
state.
you don't know why that mishap happened, but you picked it back up in '24, and I'm assuming you picked it back up in '25.
Right,
Yeah.
and in those years,
So there was a glitch that happened that caused a very major deficit.
we didn't, I can't speak to why we didn't receive the revenue from the state. That's a state agency decision, I can't speak to that, but we didn't get it. We did pay our match, but in fiscal year '24, as you can see, we increased over $120,000 from the transfers in from the general fund. And it
So-
still continued to operate in the red.
Something happened 22 and 23 that caused us to really have a deficit, and you don't know why we had that, but something happened.
Correct.
Okay, I'll stop there. Thank you.
Thank you. Going back to that, have all the revenues and receipts been accounted for?
Through
properly?
fiscal year '25, yes, because our audit is complete.
The department sent everything to you for y'all to review? Okay.
Well, they submit the invoice to the state, correct? I don't want to speak for their program. But they submit the match and they give us a disbursement, we cut the check, and then I think sometimes getting the revenue is a little bit delayed from the state.
Let me do this with 2024, looks like on the contract revenue right here, the 2024, the 207,232, did that combine the 2023 and the 2024 invoices?
It did not. The 207,232 you received in contract revenue, but of that, 103,616 is your own money down at the bottom. You have to pay the 103 to get, yeah, what Tab just said. So really, you're netting. Does that make sense?
Right. So it seems to me, Mr. Chairman, it seems to me that if the program sustained itself, but you had a little bit of glitch in 22, 23, once you got back on track, you sustaining yourself. But, I'm just going to, and that's including 5 employees in that number, right?
It's not sustaining itself.
I think the issue is that the program is only sustaining itself with support from the general fund.
Right.
Correct.
That's the,
That's the budgeted amount that we have for the program. I mean, when we started the program, we had to budget some funding to support the program.
Yeah, but it's a special revenue fund.
correct, it's not
We treat
generating special revenue.
funds differently. And so
Not
it's
easy.
her head is on the chopping block when the auditor comes and says, you have a special revenue fund and it's not being funded properly. And that's why we have to do something about it now.
Thank you.
My question is, for '26, we're falling behind again?
You're likely going to see the deficit increase, yes, because we did add a new position and we increased the transfer from the general fund. So once we're wrapping up and getting ready for '26's audit, we're going to have to do a transfer in from the general fund to cover the deficit so we can close the fund.
And my other comment is, we charge the administrator in our strategic plan to look at all the departments, look at all the budgets, and do whatever you need to do to streamline things. That was our charge to him,
Yeah.
because we would like to make sure ad valorem taxes are appropriately used.
Correct.
So
And I would add, Mr. Chair, the plan is to, going forward, this would become part of the Nexus Care special revenue account, which is self-sustaining and continues to sustain itself. And we would eliminate this special revenue account, and that would be the fix to this issue with the financials.
Chairman, I'd just like to make, hearing what we heard Ms. Rebecca say earlier, what's happening at the state level with the, I'll call it consolidation, which I'm really glad to hear, because I remember we had the picnic man. Anybody remember the picnic table man? I'm sure Gerald does. We couldn't get him in anywhere. He lived at our picnic table for months, and that was a silo effect that was happening at the state level. We couldn't get him where he needed to go. This umbrella that they have done at the state level, what I've heard today, this draft proposal reinforces what we need to do locally too. We're still providing the service for the people who need it. We all know the revolving door that we used to see with mental health patients, with families who are impacted by someone in their family who abuses substances or not, or child abuse, even child abuse, things that have happened when COSI and all that was first created. I think we have come up with a good plan at this point to integrate all these services together so that people of Beaufort County get the best services that they can get.
Is there anybody else? Comments, questions?
Just a quick question.
Yeah. By all means.
Tell me the difference between, is the disability and special needs a special revenue program as well?
Yes, it is.
So we're going to be cutting that too?
Not negative.
Okay, I was just asking. Thank you.
Now, that one's self-sustaining.
It is.
I do have actually one other question. A special revenue fund is not required to be self-sustaining like an enterprise fund, right? It just has to be separate accounting?
Yes, because it's supposed to generate special revenue.
But it doesn't have to be self-sustaining, right?
It should be, because if not, you're going to end up in the negative fund balance.
But should be and mandatory are two different things, right?
Right.
Okay, just want to make sure. Because the
special
enterprise
revenue
fund's supposed to stand up on its own.
Right.
But this is not a enterprise fund.
Correct. It's
Okay.
not an enterprise fund.
So there was never an expectation for it to be completely self-sufficient, and there may have been some expectation of general fund.
Which is how we've been transferring the funds over and over again. But after so many years, as you can see, it's not. It's the expenses have grown, but the revenue has not. And all we're essentially doing is mostly funding this by general fund revenues.
I'll just say follow up. I think from what we can tell within the community, we don't want to backslide. I think we understand the finances. I think we want to try to save taxpayer money, but not at the expense of hurting people.
Right. And from what I understand, of course, I'm not an expert in this field, but it sounds like the programs are just going to be integrated in with Nexus Care. Sorry.
I understand. All right, thank you all. Is there anybody else that has a question or comment? All right, is there anything else for the presentation? All right, thank you all so much for the update, and hopefully we can hear something else as this progresses. Thank you.
Thank you.
All right, moving into the next agenda item, which is 8B, the discussion of the potential donation of surplus property to Habitat for Humanity of the Low Country to be used for an affordable housing project and a public-private partnership to develop a veterans village. There are no funds available from ARPA for affordable housing. There are funds available from ARPA for affordable housing we would utilize for the Veterans Village project design. There is no fiscal impact for the donation of R100 03300A 021B 0000 to Habitat for Humanity of the Low Country for an affordable housing project. I believe Heather Rath, are you coming up? And Pinky.
Yeah, sorry, I ran out so fast and didn't realize that was up next. So I'm going to quickly pick up, if you guys remember back in October, Hank and had provided a list of surplus properties, which is this green sheet right here. Got it? Okay. So the first four and the three at the bottom were identified as properties that we could use. I believe you tasked at the time, Hank, with presenting options for affordable housing projects. And when Hank transitioned out, Heather and I had worked previously together in ARPA, so I kind of picked up on this project. And currently, for this agenda item, we are looking at two different things. the R100, the one that you just mentioned, which is number 12 on this list in the backup. It's the Palmetto Ridge Street lot. This is a property that we are planning to bring forth an ordinance to donate to Habitat for Humanity for an affordable housing project. But numbers 2 and 3 is a project that we're going to do as a private-public partnership, and I'll let Heather present on that because she presented back in October as well. We're going to utilize those two properties for what is a collaboration between Beaufort County, Habitat for Humanities, and we're probably going to have some other partners in the mix of this to do a Veterans Village. So with that being said, I'm going to let Heather talk to that one. Go ahead.
Heather, welcome.
Thank you very much, Chairman, and thank you, committee, for allowing me to speak. Sarah, thank you. And should I just tell you when I want it forwarded? Oh, the clicker. Yeah, but it never works for me, sorry. So Heather Rath, for the record, presenting on behalf of Habitat for Humanity. I have with me Ix Castellanos, who is our program director, Brenda Dooley, who is our executive director, and Judge Gutierrez, who is on our board of directors and is also a judge in the city of Hardeeville. So that's who I have with us from Habitat with us today. So let's talk about what is a Veterans Village. So we are proposing a Veterans Village, and we want to retain veterans exiting service in our area. This project will address our housing needs and highlight the power of collaboration. We're super excited about the partners that we can bring to the table. These Veterans Villages are not just places to call home, which of course is very important, but they also provide wraparound services to our veterans. And this is a key focus for Habitat for Humanity internationally. So let's talk about the housing challenge for veterans. 4 million veterans spend over 30% of their income on housing. 1.5 million veterans pay over 50% of their income on rent or mortgage. And then female veterans, especially single mothers, face significant housing challenges. And we've seen some of those successes in terms of building veterans villages in Brevard County down in Florida with a female veterans village. So we have some good frameworks to work off of here. So why does this matter to Beaufort County? I mean, our proximity to military installations makes us the prime candidate for building something like this. Veterans represent 11% of our population. They leave the workforce, or they leave their position in the military, and they're ripe for our area to continue working in our area. They know our area. We have rising housing costs. Everybody in our area knows this, including this council. And we're looking at 1,300 soldiers separating annually. And I put in the last line, they know our area, let's keep them here. So this slide talks about the strategic importance of retaining veterans. Of course, we have the new VA clinic coming online in Port Royal. This also positions Beaufort County as a community that proactively supports veterans transitioning to civilian life. And of course, we're bidding for the Coast Guard installation, and this could help us with that competitive ongoing push. And again, it's more than just housing, it's economic development, it's military support, and it's community building. So let's talk about our expertise. We have built almost 200 affordable homes in our area in the last 36 years. We build sustainable, energy efficient, and high quality standards, and we have the capacity and the drive and the partnerships to do the work. Let's talk a little bit about those partners in success. We've been working on this for about a year and a half, and we have reached out to so many different organizations who have all said yes when. We're talking about everybody from meetings with Nancy Mace, Tim Scott, Senator Graham, of course, our state delegation, the Housing Trust, the Chamber of Commerce with the Met Committee, y'all. Key partner in this, Veterans Affairs, the Gary Sinise Foundation. This is just naming a few. And we are prepared to work with them alongside with economic development to pull together a task force to move this forward. This is our work plan overview. So we have our planning and preparation, which includes the task force assembly. This would be in community engagement, engineering. It's very important if we go on sites 2 and 3, as we would like to request that we have that engineering done, and then setting out our KPIs, and then following our project development, construction, our integration, and then of course monitoring and evaluating those KPIs. So our ask today is a vote to set up the parameters for the public-private partnership for the Veterans Village. This is the page point area, numbers 2 and 3 on your spreadsheet. And with that, we would try and go after some, there's Lowe's Community Impact Grant, AARP. I talked with their lobbyist up in Columbia last week. They're ready to help us. The Fisher House Foundation, somebody from council sent me that. So there's just a lot of momentum around assisting veterans with housing. And we are ready to go whenever you all are. And of course, testament to collaboration, we have quotes from Claude and John O'Toole, and I'm happy to answer any questions that you may have.
Questions from the council?
No, but it is not an agenda item.
I know, and that's actually what we need to do. Well, I didn't know if Gerald had any questions with the 2 larger parcels, and Alice, I believe the other smaller parcels in your district.
I'm familiar with it.
Okay.
I don't have any questions.
Gerald, did you have any questions?
I've talked to Heather briefly about the proposal. I don't, aside from the presentation right now, I don't have a whole lot of detailed information. These are for our retired veterans,
Yes, sir.
not wounded veterans, wounded warriors.
So that would be, what we're asking for today is to establish the framework for us to move forward to establish the framework. And that would all come out in terms of what that framework looks like if we can get everybody together at the table. And so that's what the ask is today. And so if that's something that would be a desire of yours, then absolutely we can bring that to the table.
Okay, this is just for discussion, so I think, we could move forward with them bringing a proposal as to all the details of what their intent are. But I can't say definitely that I would support it until I take it to the community and get their input and their buy-in. If not, then I won't support it.
Yeah, so Councilman Dawson, if this would work for you, we would like to come and have a community meeting to see what those parameters would be according to the community. Let me go back on my slide. Sorry. Thank you. You can see Councilman Dawson right there. So when we talk about our partners for success, number 1 is neighbors community. Number 2 is Beaufort County Council members and staff. We really want members from this committee, from this council, to be part of this partnership and part of this task force. And then of course you go to Veterans Affairs, Chambers of Commerce, Housing Trust, et cetera. But number 1 on there strategically is the neighbors in the community.
Yes.
So if I read the agenda item today, it's 2-part. One would be an ordinance to transfer the 1 plot of land. Yes. And the other would be to set parameters for the public-private partnership, which Mr. Dawson's talking about.
That's exactly right.
Okay, so the ordinance would be something that would come forward. These are separate.
That's right. Okay. So there's kind of 2 paths that we're going.
Correct.
One is the parcel that's an infill lot in Chairwoman, I am so sorry, Chairwoman Howard's district. That's just a one-off habitat build that we can move forward with. The second is the larger project, which is the Veterans Village, which is where we would do the community meetings and do, all of the community input.
How large would Veterans Village be?
So there's veterans villages all over the country, ranging from 8 houses to 16 houses. There's one that's being worked on right now that's 40 houses. The land that we would want to look at if we move forward, we would want to go ahead and get engineering done on it so that we can come back and say, this is what we can fit on it. I mean, there's so many different aspects to this because where the land is, and also because we want to honor not only what the community wants, but also what veterans need, whether it's mobility issues or there's a whole various amount of input that needs to go into that, and that's where working with Carolyn Furman and everybody else would be very helpful.
So the Palmetto Ridge is only 0.38 acres.
Yeah.
Okay. But the other two, numbers 2 and 3 together are almost 13 acres.
That's right.
So, okay. It's more than one house, yeah.
And basically, these two properties in the Page Point area totals about 13 acres as well.
Yes.
So if the zoning applies, then you're looking at probably 6 homes.
So again, that's something that we can talk about once we get in there and understand what that would look like.
Okay, thanks.
I had one question.
Yes.
If I'm sure Councilman Dawson knows, there's no sewage at Page Point, right? It's just water?
Water.
Okay. And there's no sewage at Palmetto Ridge. It'd be septic there too, so.
Glover.
Yes, Mr. Rath, thank you very much. I would love for you to consider property number 15. Thank you.
Part of your discussion may be whether or not they're going to seek a upzoning because 13 acres is very limited if it's one house per 3 acres.
Well, I did see as well, Mr. Glover mentioned the 15, which is 4.7 off of Ballpark Road. Would we want to include that as well?
I would love for her to consider.
Well, I mean, this is the opportunity. Yeah. Do we want to expand this vision and put some on St. Helena, have some in Dawson's district, and make a bigger impact? I mean, if we have this land just sitting there, why not put it to good use and help our veterans? I mean, is there any? I mean, this is still discussion only, so let's talk about it.
Right.
Right. I think that very possible to do that for a separate project, but for the Veterans Village is the 2 properties at Page Point.
I mean, if we got ARPA money to plan for it, why not incorporate it?
Well, that's another reason why I wanted to bring that up is because as we start this and start doing the engineering and design and all of that, we have the ARPA affordable housing funds that we do need to spend down before the end of the year. So this seemed to be impeccable timing for this.
Right. Would we, I know we can't really make a motion here or necessarily, but would the will of council or committee here be to expand that and incorporate it?
This committee can, in fact, make a motion, because we're not the council that requires a 2/3. It's a simple majority of us that can make a decision to move to council, obviously, the one piece of property.
Right, we'd like that ordinance to come to council.
And, direct our administration to work with Habitat for Humanity, exploring the other pieces of property that are on this page for the ability of affordable housing or veterans housing.
Is that a motion?
I was just about to say,
That's my motion.
is that a motion?
I'll second it.
Yeah.
Second? All right. Is there any objection to that? Oh, hold on, I got see Brian over here.
Just to be clear, the motion you're talking about is to forward both issues, the ordinance for the .38 acres, and then for number 2 and 3, as far as a Veterans Village, to council for discussion and potential direction to staff to bring stuff forward.
Right.
Okay.
And would that be to
And
include number 15?
Yeah.
And 15.
Actually, I would like to include all of the properties that are in green, because you never know
There you go.
if all of these may be suitable for some type of housing, whether it's veterans housing or affordable housing.
And what about number 1? Isn't that all in the same? Why wouldn't you pick up 1? That's what
It's a
Mr.
separate
Passman's
one.
talking about.
Yeah, and I can't remember what.
I don't think that one is right by the other one,
Yeah.
No,
right? Gerald, isn't that one?
number
Around the
1.
bend, around the corner of
It
it.
is, maybe, okay.
Okay.
But anyway,
Without looking at the map, I can't tell.
Mr. Chairman,
Call me David.
number Number 4, in the industrial park, that one is in the, I think, in the accident potential zone, so it would not be
The
appropriate
acres.
for housing. And then, but I agree with Councilman Passmore, why not do them all? The only thing with the former water slide is it's right on the highway, but it's on St. Helena, right? Yeah, but I would not include number 4 on the list.
Well, do we want to include it and just have it
Yeah.
be nixed out later?
Right, and they will be able to come back to us and say it is not suitable. Rather than just take it off and later find out, well, we could have done something.
We can't in that one.
I mean, if it's ACU, so they'll confirm it.
No, it's accident potential zone, which
It
is
is.
worse than
Oh, okay,
ACU.
okay.
Yeah, which is forbidden, yeah. I mean, not forbidden, but it's against our own ordinance.
I got you.
Yeah.
Well, Joe, I just want to make sure, I know we kind
Right.
of changed the informal motion there, but
Right,
is
so
that,
the motion is to move forward to council the one property that's on Palmetto Ridge Street, okay? And for us to have moved to council for discussion, the ability to use 2 pieces of land on Page Point Road for a Veterans Village, directing administration to begin that process.
The plan would be for the first meeting in April.
Yeah. Okay?
and did that include the other properties?
Yeah, what about the other
And
property?
explore the other properties
Okay.
for suitability.
And you second that? I know it changed, but just want to make sure it's still second on that.
I'm fine.
Okay, is there any objection to that? All right, then it'll move forward to council. Thank you all.
Thank you.
Thank you, Heather.
Thank you also very much.
Looking forward to this partnership and doing some good out there. Now moving into the actual agenda items, 9A, which is a resolution authorizing the county administrator to enter into a memorandum of agreement with Marine Corps Recruit Depot, Parris Island for mutual emergency medical response. There is no fiscal impact, and I believe, John, you're
I will
going to be
make
doing the
that
presentation.
motion.
All right, is there a second?
I'll second it. Okay, Mr. Dyson, go for it.
John, come on down.
And I'm happy to answer any questions. It's a pretty straightforward reciprocal mutual aid agreement between Parris Island and Beaufort County, in this case, for specifically Beaufort County EMS.
All right, are there any questions?
I have
Yes.
a question. Is there an existing one with MCAS Beaufort?
There is, but it's specific to fire service, so not for EMS.
I got you.
This would just assist the military and backup as well as normal operation, assisting them with emergency transport.
Yes, sir, on both sides. So this would allow the paramedics, and which is part of the fire department on Parris Island, help support Beaufort County EMS, as well as Beaufort County EMS support the operations on Parris Island.
All right. Let's take a vote on that. Is there any objection to moving? That doesn't need to move forward to council, right? That's just resolution. No, it doesn't need to go to council. All right. Any objection to send that to council?
No.
All right. So you know that will be moved forward to council. Moving forward to 9B, a resolution recognizing April as Fair Housing Month, no fiscal impact. And Audra, you are up. Can I get a motion in a
I'll
second?
make the motion.
All right. Thank you. Is there any real report on this? I know it's just a resolution.
Right.
Yes, sir. It's our annual resolution. We're required to for the community block grantees.
Is there any questions, comment, anything on this? All right. Once again, does this have to go to resolution to council? All right. Then any objection to move this forward to council?
No.
Seeing none, it will be moved forward to council. Thank you. 9C is a resolution authorizing the county administrator to enter into a memorandum of understanding with the Port Royal Sound Foundation for collaboration on natural resource monitoring and outreach, including work on the National Fish and Wildlife Foundation grant awarded to the county. There is no fiscal impact. The Port Royal Sound Foundation is included as a named partner and sub-awardee on the National Fish and Wildlife Foundation grant that was awarded to Beaufort County in 2024. The budget
make a
includes. Wow, let me finish reading the item. Hang on now. You do the same
You gotta
thing.
keep reading them.
The budget includes $15,100 for Port Royal Sound Foundation to support education and outreach for the project outcomes. I have Rob Merchant down, but you look like Chuck.
Sure, Robbie
I
has.
need a motion.
Yep.
Motion,
Yep.
somebody needs to second it.
I'll second it.
All right.
No impact.
So this is a multifaceted project. The total project cost to include what is being contributed by Beaufort County, College of Charleston, the Seagrass Consortium, and the Port Royal Sound Foundation is $322,721.50. The total awarded grant funds is, we got what we requested, which is $169,667.50. And the total in-kind contributions of all the players, with Beaufort County making the most contributions for in-kind, because they're using our GIS system, they're using some public works equipment, is $153,054. And what we're asking for today is the MOU to allow the Port Royal Sound Foundation to use the $15,100 as a working partner in the project. So that's what we're asking for.
All right, any questions or comments? No. All right, well, can this be moved forward to council with no objection?
Yes.
Seeing none, it will move forward to council. Thank you, Chuck. And is there any further business to come before this committee? Seeing none, this meeting is adjourned.